A rash after your shot can be minor. Swelling can still be the bigger clue. Wegovy, Semaglutide, and Zepbound, Tirzepatide, can cause simple skin irritation, but they can also trigger allergic reactions that need urgent care. What matters most here is not the color alone. It is where it spreads, how fast it changes, and what else happens. Many people see a pink patch and assume allergy right away. Others do the opposite and ignore swelling because the shot went under the skin. Both reactions can be mistakes. A local mark is common. A spreading reaction is different. The first useful split is simple: a local skin reaction versus a reaction that spreads beyond the shot site. A local reaction stays near the needle site because the needle and fluid irritated one area. A broader reaction moves beyond that area because the immune system is reacting more widely. That split gives you the first practical answer. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. These drugs go into fat under the skin. That alone can leave a small red patch, mild itching, or soreness. The needle passed through the skin barrier. The fluid also sat in one small area for a while. That irritation is usually short-lived. Technique can add to that irritation. Using the same spot too often can make the area more reactive. Injecting into already irritated skin can do the same. Rubbing the site hard after the shot can also worsen redness. Those reactions usually stay local. A true allergy works differently. Allergy means the immune system reacts to the drug or another ingredient in the pen. That can cause hives, which are raised itchy welts. It can also cause deeper swelling under the skin, especially in the face or lips. That is why facial puffiness matters more than a small pink patch. Timing helps, but timing does not solve the whole problem. Mild irritation often starts soon after the shot and fades. Allergy can start soon too, but it may also return after later doses. A reaction that repeats after each injection deserves more respect than a one-time sore spot. The patch that looks worst is not always the one that matters most. A mild rash that spreads farther each week can matter more than one angry-looking patch that fades by tomorrow. People often judge by color and size. Better clues are spread, recurrence, and other symptoms with the rash. Some people also blame the wrong cause. They focus on the needle and miss the pattern. A local injection problem does not explain hives on the arms, swelling around the eyes, or a tight throat. Once the reaction moves away from the shot site, the explanation has to widen too. That pattern matters even more in people who already have a higher risk of true allergy. Risk is higher in people with a past history of drug allergy or unexplained hives. Risk also rises when someone has reacted to a previous dose and then takes the next one anyway. The next exposure can hit harder. The body has already seen the trigger once. Risk is also higher in people who may miss or misread early symptoms. Older adults living alone can underestimate swelling until it becomes obvious. Anyone with memory problems may miss the timing pattern between each weekly dose and the reaction. That can delay the right decision. Risk is also higher when the history is hard to sort out. Several possible triggers may show up in the same week, and that can delay the right call. Then the wrong product may get blamed, or the real trigger may be missed. Another risk is distance from care. A person living far from urgent care may wait too long because the first signs seem small. That is especially true after a weekend dose. Timing mistakes can delay treatment. Those higher risk situations shape which warning signs need the fastest response. Hives on areas far from the injection site are more concerning than one sore bump. Swelling of the lips, eyelids, tongue, or face is also more concerning. Those patterns suggest the reaction is not staying local anymore. Breathing symptoms are even more concerning. Chest tightness, wheezing, throat pressure, hoarseness, or trouble swallowing can mean the reaction is affecting breathing. Dizziness or faintness adds another layer of concern. A skin reaction plus those symptoms is not routine irritation. That combination can turn dangerous fast. Other body symptoms can matter too when they appear with rash or swelling. Vomiting or diarrhea alone can happen on these drugs, but vomiting plus hives, dizziness, or lip swelling can point to a broader allergic response. The combination matters more than any one symptom by itself. There is also a slower warning pattern. The first week may bring mild itching, then a wider rash. Later, swelling may last longer. That staircase pattern is easy to dismiss because each step looks small. Taken together, that pattern can mean the reaction is getting stronger. The speed of the change matters too. A patch that doubles in size over a few hours deserves more attention than one that stays the same all day. The same is true for swelling that moves from the shot site toward the face. Speed tells you the process is active, not fading. What you do next depends on the pattern. If swelling affects the mouth, tongue, throat, or breathing, seek emergency care right away. Do not take another dose. Do not wait for symptoms to prove they are serious. Breathing symptoms are the line where caution becomes urgent action. If breathing is normal but the rash is still spreading on the skin, contact the prescribing clinician promptly. Take photos. Note when the dose was given and when the rash started. Report whether this happened after earlier injections too. That helps more than memory later. If the reaction is small, stays local, and improves within a day or two, watching it can be reasonable. Keep the area clean. Avoid scratching it open. Rotate the next injection site. But if the same local reaction gets bigger after each dose, stop assuming it is harmless and report it. That caution also applies to the next dose. Do not try to outguess the pattern by taking the next dose early or changing the site at random. That can muddy the picture and make the reaction harder to interpret. Better information leads to a safer next step. Once the action decision is made, prevention matters more. Good prevention starts with the skin itself. Do not keep using the same small area every week. Avoid broken, bruised, or already inflamed skin. Let the site rest after each dose. Another part of prevention is keeping records clear. If a rash shows up after each dose, write it down. Note when the dose was given, how fast the rash changed, and whether swelling spread beyond the shot site. Good notes can keep you from taking another dose before the cause is clear. Simple technique is another part of prevention. Rotate sites in a predictable way. Do not rub the area hard after the shot. Do not inject into skin that is already irritated. A cleaner routine makes the next reaction easier to judge. The bottom line is simple. Local irritation usually stays local and fades. Allergy tends to spread, recur, or bring swelling and other symptoms with it. The shot site alone is not the whole story. Pattern tells you when to stay calm and when to take it seriously. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.